Welcome to Inside Healthcare with CEO and President of MagnaCare, Joseph Berardo Jr. Today he'll be discussing micronetworks, broker tools. What is a micronetwork?
A micronetwork really, in many ways, is the early part of an accountable care organization. And for the broker community, what I think you need to know really is to understand that everything that's been called an accountable care organization in the past isn't necessarily a true accountable care organization. What we do have going on in the marketplace is a lot of networks organizing into little micro networks, little local, in some cases regional or county-wide networks of providers, usually organized around a multi-specialty group, a hospital, an IPA, or just a group of providers that are in a region that are coming together and have agreed to try to become more efficient in the delivery of care. They're going to share information. Perhaps they're going to be on the same electronic medical record. They might be part of the same system, or in some cases even owned by a larger hospital system. And the micro network, for the most part, is designing itself to become a product. They're going to become a product in the commercial world, in the Medicare world, in the Medicaid world. And really what we have the opportunity to do within the industry today is take advantage of the organization of these providers and the information that they're willing to share between each other to deliver a more efficient product that's better for the chronically ill as well as the everyday employee who's just looking to seek their everyday care.
How can understanding micronetworks grow your business?
You know, as a broker and an advisor and a trusted advisor to these employer groups, understanding that micronetworks or integrated delivery systems can provide more efficient health plan administration and health delivery really becomes very important. The world of just presenting new rates and renewals is over. If you are just going to spreadsheet the competitors in the marketplace, I can tell you that there'll be others showing more clinically focused, more integrative solutions to your customers. So as a broker, it really becomes imperative that you start to understand what's going on in the medical delivery community in which your customers are seeking their care today. If you wait to see the products or the big press releases that are being given on the accountable care organizations and really don't understand what's developing around the populations that you currently serve, you might be left out in the cold. So what's important about the micro network, it's really an efficient way. If you look at how care is delivered, if the member is going to an integrated network, there's a reduction in duplication of services. There might be a reduction in emergency room visits. Emergency room visits typically result in 29% of unnecessary hospital admissions. So you want to make sure that you're working on products and programs that focus the membership's care delivery on systems that are organized and integrated to deliver care in a much more efficient way. And if you're bringing those solutions to your customers, I believe you're going to have customers for life.
How do clients benefit from utilizing micronetworks?
Well, if you think about the financiers of healthcare, for the most part, these guys are paying for the bill. So if you put a program and develop it around providers that are organized and are committed to delivering more efficient care, your client's going to be the winner. They're going to be a winner through decreased claims costs or lower trend, or for the most part, even better stop loss purchasing power because they're going to be managing the chronic illnesses much better. So if you look at the ability of a micro network to really impact the cost of the health plan, for the most part, you have an employer that could probably go back to their members and say, listen, we're going to lower our co-pays on this group of providers because we want you to see these guys because they're efficient, they're well managed, and they're going to provide better care. So there's a benefit to the membership. To the employer, if the care being delivered is in fact efficient, it's not being duplicated, people are getting the right care in the right setting at the right time, it's going to be more cost effective. So from an employer perspective, they really can benefit in a lower cost trend or even lower costs, and clearly lower costs over time. The best part of the whole thing is they're going to get all the data. So they're going to understand what's driving the costs within their plan. They're going to understand who's using the micro networks and who's not. They're going to understand where they might have to develop other provider relationships to serve other populations. It's a purely transparent way to deliver a health program with better information than they've ever received from a health plan prior.